Ronny Jackson is back with us. Doctor, thanks for getting back in with us. I know you've been up nonstop since this broke out. I appreciate you spending time with us.
You bet. Thanks, Sean. I appreciate you guys having me.
You bet. So have you been in contact with the president and his team?
I've talked to them at the White House some today, early this morning, and everything seemed to be going well. They said the president was doing well. He was feeling well. I've heard since then, I saw that in the New York Times report that there was some folks that you were speculating, from an observational standpoint, from something they saw in Bedminster, that he looked tired and that he may have symptoms. But I think we wait and let the president tell us if he has any real minor symptoms or not, because it's my impression that he's essentially asymptomatic right now, and I think that's good.
Yeah, it's amazing. I mean, first of all, I think considering the schedule he normally keeps, and you're well aware of that I wouldn't be surprised if he's been tired the last 3.5 years. So, but walk me through the treatment plan going forward. What would you be recommending to him? And I get that we're doing this from a distance, so I'm not trying to put you on the spot, but I'm saying, does it just, hey, rest a lot? What is the standard sort of medical prescription, if you will, going forward?
Well, as well as I do, Sean, it's going to be hard to make him rest. He's going to keep pushing hard, and he's not going to rest a whole lot. He's just not in his nature. If you get would be welcome, but a lot of this is going to depend on whether or not he actually does have symptoms. If he's truly asymptomatic, he's in a very good spot right now. I mean, if you look at the statistics for someone just like the president, 74 years old with no comorbidities, no heart disease, no lung disease, no diabetes, no immunosuppression, there is a 99.5% chance that he's going to recover from this uneventfully. Most of the people in that category will not even know that they had it. And the ones that do will only get minor symptoms. So, he's in a very good spot, and I think he's very healthy, and I think he'll make it through this. But if he does develop symptoms, it is reasonable to think they might go ahead and start trying to treat him a little bit. And I think hydroxychloroquine is a reasonable start. He's had that before. Right. He took it in prophylactic doses, prophylactically. And, it'd be a little bit higher dose for the treatment, but we know that it's not going to have any negative effects on him. He's not going to have a reaction to it. He's already had it. Other thing is azithromycin, Z-Pak. He's had that before. That might be something they look at. Vitamin D, zinc, and maybe even inhaled or nebulized steroids. All pretty benign things that they could do, that wouldn't hurt him but might help him. But
let me ask you this.
Things that could step up.
Anytime that I come down with a cold or the flu, the first thing that a doctor says is go home, drink lots of liquids and fluids, and rest. You're absolutely right. This president doesn't know how to rest. But how important is that, not just to him, but to our country, that he gets the appropriate amount of rest? I know it's not in his DNA to do it, doctor, but at the end of the day, it's not just about him anymore. It's about him being able to continue as president and govern appropriately. So to what degree do you or, the doctor that's treating him now say, Mr. President, for the good of the country, please, take a nap, go to sleep early? How much does that factor into it?
Yeah, I'm sure they're encouraging him to do that. And if he could do that, that would actually help. He does have the virus, even if he's not, having a lot of symptoms. But, I also want to see him get out there, and I want to see him just be the president that he's been. I want him to reassure the public that he's fine, that he may have the virus, but that he feels good, that he's still governing. He's still our commander in chief. He's still the leader of the free world. And I think he's going to do all that. You know as well as I do that this is going to have an impact on his ability to campaign for the next week or two, but it's not going to have an impact on his ability to govern.
Okay, so can I ask you this, though? As his doctor, right? So there's HIPAA laws that govern all of us, what they can do. But what would you be advising? Like I as a citizen, right? I think the question is, where's that line about what we have a right to know in terms of our president's health? Because it's not just President Trump. You've advised other presidents. So where's the line between us saying, okay, you're right, 99 point whatever, 45 .45 that you said, but the point is that what point do we as Americans have a right to know how he's doing?
Well, I think we have a right to know in this particular case. Coronavirus has been a big issue for our entire country, and lots of people have lost their lives to it. So I think if the president gets that, I think it's an obligation for he and his doctor to share that with the public and share with them what they're doing. And they've done that. I mean, they were very quick to come on right on out, get him tested, tell the public that he and the First Lady tested positive. And, they're working hard to do the contact tracing to find out who else might have been exposed, and also to find out where maybe he was exposed at, because we don't know the answer to that yet. But, I think he's being very transparent in all of this. And I think, he hasn't tried to hide anything. And I appreciate that. And I think most Americans do.
The speculation in most of the media today I find astonishing. We have a Constitution. It's very clear about our continuity of government, our succession programs. That being said, right, what precautions should the vice president be taking, if any?
Well, they're probably keeping the vice president away from the president right now, because the vice president tested negative and the president's positive. So it'd be a good idea to kind of keep them separated right now. I told people that, the president's going to be in relative isolation or relative sequestered. He's not going to, he's still got to be president. He's still going to be surrounded by those key people, at the White House that have to be there. They're going to make it essential personnel only. But as well as I do, he's still going to have interactions with his chief of staff and with his press secretary and his military aide and, his national security advisor, and do those kinds of things. They'll wash their hands. They'll wear masks. They'll do social distancing. But, it's not like if you or I got it, they would send us home from the White House and tell us, don't come back until you can verify that you don't have this. He still has to go on and be our president.
Does it concern you, these rapid tests, are they of concern to you? It seems like a lot of people say that they don't have the accuracy of the more in-depth one, that they stick the thing way back further in your nose that hurts like horrendously and is not pleasant in any extent. But is the rapid test a concern to you?
No, I think the rapid test is a good test, and I think it gets a bad rap because the other one does pick up more infection or more evidence of infection than the rapid test does. But to be honest with you, the other one, it's a much deeper test. It goes way back in the back,
yes,
and it swabs areas that still may have viral particles that aren't infectious anymore. And so I think the rapid test is just as good as the deep test on whether or not you're still infected. Now, the deeper one might tell you that you had an infection where the other one didn't if you weren't having symptoms. But I'm comfortable with the rapid test.
Yeah, I've had both. I will tell you I'm much more comfortable with the rapid one. The other one is rather intrusive and not pleasant. Doctor, before I let you go real quick, I don't have a ton of time left. There's a debate. It's within 2 weeks. Do you recommend that the president continue on schedule to do that debate?
Absolutely. I mean, this debate's far enough out that this is not going to have bearing on that debate. I mean, I fully expect the president, to remain asymptomatic, or if he does have symptoms, have minor symptoms, get past this. They'll continue to test him every single day. And once he's symptom free and he has 2 back-to-back tests, 2 or more negative tests that are 24 hours apart, he can go back to his normal routine and he can certainly engage in that debate.
Okay, so 2 back-to-back tests. Good to know. That's interesting. All right, doctor, I'm going to play doctor. You've been up a long time. You've been working really hard. Go get some rest and drink lots of fluids.
Yes, sir. Thank you, Doc.
That's as close as I'll ever come. All right, Dr. Ronny Jackson, thank you very much.